Today, we're tackling a topic that affects all of us, blood pressure. You've probably seen those two numbers on your readings, but what do they really mean? Why are they so important? In this video, we'll unravel the mysteries of systolic and diastolic blood pressure. We'll discover how your heart works hard to keep you alive and what happens when those numbers go awry. So if you want to empower yourself with knowledge and take charge of your health, stick around. Let's jump in and find out what those numbers are telling you. Ever wondered what those two numbers on your reading really mean? Let's break it down. The top number, called systolic blood pressure, measures the force as your heart pumps blood. The bottom number, diastolic blood pressure, shows the pressure when your heart takes a breather. Both numbers matter, and knowing how to respond when they're off is key to staying healthy. Ready to find out which number holds more weight? Let's get started. Historically, doctors believed diastolic pressure was more important. They thought systolic pressure naturally rose with age. The top number was often ignored unless it was extremely high. Even slightly high diastolic pressure was treated with medication. It was thought that resting pressure reflected overall heart health, but recent studies show a different story. Let's first talk about high systolic pressure. It can be caused by artery stiffness, an overactive thyroid, or diabetes. Sometimes, it can result from heart valve problems. Older people are at higher risk of high systolic pressure. In fact, it's the most common form of high blood pressure in those over 65. If you're over 50 with high systolic pressure, you're at greater risk for heart problems. These include heart attacks, strokes, chest pain, and chronic kidney disease. These conditions are serious and should not be ignored. Now let's look at high diastolic pressure. High diastolic pressure can weaken your aorta, the main artery in your body. This artery runs from your heart through your abdomen and branches into your legs. A weak spot in the aorta can turn into a bulge, called an aneurysm. If the bulge bursts, it can cause serious internal bleeding, which can be fatal. This life-threatening condition is known as an abdominal aortic aneurysm. So which number is more important? Both are equally important, as each carries specific risks. If either systolic or diastolic pressure is high, it should not be ignored. Taking blood pressure medication doesn't always eliminate these risks. A study found that even those controlling their blood pressure with medication have a higher risk of heart disease. For example, a 30-year-old with high blood pressure has a 63% lifetime risk of heart disease. This is compared to 46% for someone with normal blood pressure. This shows that even with medication, heart risks remain high. The key is to monitor both numbers regularly. Eating healthy, exercising, and tracking your blood pressure are vital for a healthy heart. If you suffer from high blood pressure, stay vigilant. If you found this information valuable, please give this video a thumbs up, share it, and subscribe to our channel for more insightful content. As always, take care of yourself and thanks for watching.